Hello everybody. Now I'm here to share some of the points on care of vulnerable patient. This is also coming as an essential unit in patient safety indicators. So yes, do you all agree that patient safety is very much essential? Yes, patient has come to us and he is like totally denied and is helpless, where he is putting his all efforts on us. So we, the professionals, have to care that the patient is going home without any other injury or any other harm. So how are we going to handle such patients? So, who is a vulnerable? A patient who is, or maybe for any reason, unable to protect or unable to take care of himself or herself against significant harm of exploitation is termed to be vulnerable. In simple terms, who needs some assistance, who is unable to have a sound decision of what to be done. Those patients are coming under vulnerable, might be physically, emotionally, socially, spiritually, and so on. So, who are the vulnerable patients? Yes, infants, they are very, very small, they cannot walk around, they cannot call out and say what is happening within them. Children, disabled individuals, elderly, more than 60, child abuse and child neglect, domestic violence, sexual assault, abuse, all NICU, ICU, and patients who are in coma and ventilated patients, substance abuse, mentally retarded, and patients who are in crisis. How do we assess the vulnerable elderly? So, the elderly will be given a big care on the neurostatus, assessing the neurostatus daily, because they are at risk of developing Alzheimer's disease, and that's why Alzheimer's and dementia. So, that's why we will be screening the vulnerable cases for neurological assessment. Along with the neurological assessment, we also check in for the psychological status and their mental health and whether the patient is able to do the activities of daily living of their own, how is their physical condition, that is general physical health, as well as we'll be screening for nutritional assessment as well as functional risk assessment, whether they are dependent, independent, or they are in the intermediate level. Fall risk assessment is also done for vulnerable patients at all the hospitals. In case of a vulnerable young children, we are going to check in for a detailed examination of the general condition. As well, we will be assessing the medical condition and surgical condition. Along with that, in case if the child is being suspected to any abuse or maltreatment, those children are also screened and they are kept very confidential. What are the care and policy to be done in case of a vulnerable patient? So this will be applied in all admissions and transfers. That is, admissions is like when the patient is dropping into the hospital, transfers might be he is sick, he is shifted to ICU or he is shifted from ICU to ward and vice versa. When the patient condition is very critical, then we have to care the patient and staff needs to be trained on handling how these patients to be handled, close monitoring, safe environment given to these vulnerable patients such as equipment, wheelchairs, bed drains, mobility needs, fall precautions, family involvement and support in care delivery and education, and special consent. So this is care for vulnerable patients who are high risk for developing fall in pediatrics, which we use is called as the Humpty Dumpty Fall Risk Assessment Scale. So in this scale, they are going to assess the age, the gender, diagnosis, cognitive behaviors, environmental factors, response to surgery and sedation, and what was the medication usage. In this, the scores are given like from 7 to 23. So which shows like any score which is 12 or above, they are all at risk for. And this is the OFRA scale which is given for a patient who is known obstetric cases, pregnant mothers, we can use this OFRA scale. So in this, they are going to assess the past history, whether there was any last fall in the last trimester, visual impairments, cardiovascular problems, especially they are screening for any preeclampsia, postpartum hemorrhages in the postpartum period, any medications, whether the patient is receiving IM, IV, narcotics within 30 minutes, neurofunction and anesthesia, and motor activity. So here they are giving a scoring interpretation of 0 to 8. 0 to 2 is no fall risk, and might be from 2 to 4 is high for mild risk for fall, moderate risk. Anything for above 6, anything above 10 or 12 is high risk for falling. And that's all for today. Thank you all. If you have any doubts or any queries, please place onto the comment box. Don't forget to like and share and subscribe. Thank you all once again.